Hi, this is Dr. Brandon Erickson. I wanted to talk to you a little bit today about elbow release surgery and what to expect afterwards. Now, an elbow release is either done arthroscopically through some poke holes around your elbow or through an incision either on the inside or the outside of your elbow. And how we do it depends on how bad your arthritis is and if you have any nerve symptoms in your fingers, either before surgery or that you've had leading up to the surgery. Now, if we do the surgery arthroscopically, as I mentioned, it's only done through a few poke holes and it takes about an hour to do the surgery. If we do the surgery open, we do it through an incision, and if we do it on the inside of the elbow, we also decompress the nerve at the time of surgery. If we do it through the outside, we don't have to decompress the nerve, and whether, again, to do that depends on if you had some symptoms beforehand. What we do with surgery is we go into the elbow and we get rid of all the extra bone that your body's formed and get rid of all the extra very tight capsular tissue, which is kind of a water balloon that goes around the joint that can get very thick and irritated and prevent your motion. And we take your elbow through an entire full range of motion at surgery, and we get your full range of motion back at surgery. Now, the reason I say that is because when you wake up from surgery, the elbow is going to already start to try to stiffen up. So there's some really important things that we have to do after surgery. I want you to start rehab right away after this. You have to start therapy the next day. They work on getting some of the swelling out of your arm, and they also work on your bending and straightening. It is very important that you do this after surgery because the body wants to stiffen the elbow up again, and I don't want you to go through a surgery and then not get the maximal amount of motion improvement that you can. So we have you start therapy right away. After surgery, you have a light dressing on your elbow, and that stays on for a couple of days, and then it can come off. If you had the open procedure, you'll have a waterproof bandage on over that, and you can shower with that on normally. You don't have to cover it. If you had the arthroscopic surgery where there's only a few poke holes, you can shower normally and then cover those poke holes with a Band-Aid afterwards. I see you back in the office in about 7 to 10 days to check your motion, but certainly if you need me beforehand, you just call me. Now, you'll have a nerve block to help with your pain after surgery, and that'll wear off in about 8 to 10 hours after surgery. I also send you home with an anti-inflammatory medicine, some Tylenol, and then some pain medicine. I want you to take the anti-inflammatory and the Tylenol pretty much scheduled for the first few days, and you only take the narcotic medicine if you need it. If you don't need it, don't take it. But it's really important that you work on getting the elbow completely straight and bending the elbow up right after surgery because I do not want your elbow to stiffen up. The other thing you go home with is a medicine called indomethacin. That's important because it actually helps prevent your body from reforming some of that bone that we took out at the time of surgery. So what the body can sometimes do, even after we debride all of that bone, is it can start to reform that bone again. And so by taking that indomethacin, it actually decreases the risk that your body's going to reform that bone. So that's very important to take that, okay? Now, the other thing that'll help with your pain is also to ice the elbow. So either a big bag of ice or an ice machine that you can purchase will help get some of the swelling out of the elbow. And again, the more you move the elbow, the better your motion is going to be. Now, these are just some of the common questions that we get after surgery. You can always feel free to reach out to myself or my physician's assistant with any questions that you might have, but hopefully this can help answer some of the questions that you have. Have a nice day.